In Bologna, we are conducting a prospective study enrolling patients with a new diagnosis of multiple myeloma, with the aim of comparing diagnostic performance of PET-CT and whole body diffusion-weighted MRI, both at staging and in response assessment. We have observed that whole body diffusion-weighted MRI has a significant superiority versus PET-CT in detection of both focal lesions in all skeletal districts except from the skull, and in detection of paraskeletal disease. I also want to underline that the two techniques have a perfect concordance in detection of extramedullary disease. We know that PET-CT has always been considered the standard and recommended technique for detection of extramedullary disease, but even though we have a small amount of patients with the EMD in our study, the concordance was perfect between the two techniques. We also observed a slight concordance in detection of diffuse disease, and this is something that we are going to study more. The International Myeloma Working Group recommends whole body low-dose CT as the minimum requirement for diagnosis of multiple myeloma-related bone disease, whereas PET-CT is currently considered a potential alternative, and is right now recommended for response assessment for the study of imaging minimal residual disease. However, MRI studies right now are recommended in patients without CT or PET-CT assessed osteolytic lesions and in absence of other myeloma-defining events. However, whole body diffusion-weighted MRI has a significantly greater sensitivity than PET-CT, and so standard first-line imaging technique when and where it is available. But I also want to underline that the two techniques in our study have a great concordance also in response assessment, and this suggests that whole body diffusion-weighted MRI could become an alternative technique to PET-CT also in assessing of imaging MRT.